diastema closure, that is the closing the gap between the teeth. So people are asking at what age you can start doing diastema closure, especially for the children they are worried about. For children to have a gap between the front upper teeth is very normal. It's physiological. At the age of from 9 to 11 there will be a big gap, maybe which is not present before and now it's been increased. So at this stage the kids are called ugly duckling, though it's at all not at all ugly. I find it very cute, and but it's called ugly duckling stage, and that is the stage when the permanent canines are erupting, and because of that the gap between the front teeth increases for the time being, but it will be settled by its own. For the correction you do not need any treatment, but if it persists by the age of 15-16, you can think about options to be closed. Do all diastema need to be closed? Is there any harm if you have a diastema? Well, generally speaking, no. It's just a gap, and it's not going to give any kind of cavity or anything. Mostly diastema closure, the gap between the teeth is closed for aesthetic purpose. So if it bothers you, if you're conscious about it, then yes, you should seek for the options to close it. Now, what are the options to close diastema? The most conservative way to close a diastema will be with the help of braces, which is the orthodontic treatment. Other than that, it can be closed in one sitting by using filling materials like composite. And there is another solution, which is ceramic veneers. It's quite a permanent solution to do that, and it gives you a good finished look. Now there are few type of gaps which are not present before and now they are forming, and people take it as it's just aging and that's why your teeth are moving this and that, but there are three to four major reasons to that why it's happening. One of the main reason is the calculus which is deposited from years and years on your behind the teeth, and now it's weaken your gums and periodontium and all the surrounding structure which holds the teeth, and that's why that is weak, and that's why whatever forces is working on that, it's pushing them away. The second reason could be the missing teeth. When there is one posterior teeth or one back teeth which you never replaced or something like that, and now the teeth have a tendency to move always, so now the gap is forming. Or it could be a habit in which the patient just thrust when they swallow, they push their tongue on the teeth, and that's why the gap is increasing now and happening now.